Pain invaders. Cycling is a hugely popular sport in the UK and offers significant health benefits. But it can also result in podiatric issues that require careful management to keep riders in the saddle. This story for the Podiatrist was written by Matt Lemmy. Part 1. Introduction. Cycling is fantastic. It's physically invigorating. It's mentally uplifting. It's calming, efficient, clean, fast, slow, relaxing, and exciting, because what you experience on the bike is almost entirely in your hands. Cycling can be whatever you want it to be. But as hard as it is to believe now, there was a time when Britain was fairly ambivalent about the joys of cycling. With a few notable exceptions, we rarely produced anybody who could compete with distinction in international cycle racing, and the idea that tens of thousands of Brits would commute each day by bike was laughable. Then the millennium happened, and we started winning not just masses of Olympic cycling medals, but even races like the fabled Tour de France, where precious few Brits had ever previously troubled the top order. Cycling became a British strength, and with it came a huge rise in cycling culture, from mammals, middle-aged men in lycra, to family riding, and a very noticeable growth in women's cycling, according to Cycling UK. But recently, progress has stalled. Unfortunately, the kind of enthusiasm we saw in the 2000s and 2010s has waned a little in recent years, says Simon Richardson, editor of Cycling Weekly, one of the UK's oldest magazines. Britain doesn't win the Tour de France anymore, and winning Olympic medals has become seen as the norm, not an exciting achievement. We lost the Tour of Yorkshire, then we lost a few other UK races, so we're a little bit in the doldrums right now. Lockdowns during the pandemic did give cycling a significant boost. However, according to Cycling UK, general cycling levels are now back at pre-pandemic levels, and in terms of the British cycling industry's long-term health, COVID-19 actually had a strangely negative effect. There was a huge boom in participation during the pandemic, but the industry couldn't keep up with demand, Simon says. By the time products did eventually flood back into the UK, people had returned to their cars. That left businesses stuck with millions of pounds of stock that they couldn't sell, and, over the last 2 to 3 years, a lot of companies have gone bust because of that. Part 2. Resurgence. Seasoned cycling experts like Simon know there has always been an ebb and flow to cycling's appeal, particularly in the UK. Admittedly, the highs of the last 2 decades have been higher than anything seen before, and the subsequent lows are therefore perhaps felt more acutely, but cycling is still viewed much more positively in the UK since the late 20th century. If you put a big cycling event on, people will still come out, Simon says. The Tour de France is coming back to the UK, to Edinburgh, in 2027, and there will be massive crowds for that. The benefits of cycling are as relevant today as ever. In terms of public health, it's probably the biggest intervention anyone can make. When the Ride London Cycling Festival has been on, Transport for London would release air pollution charts, and you could see air pollution just drop off a cliff whenever that event was being held. Even if you got 50% of people out of cars and onto bikes, you would clean up the air in our cities overnight, which each year causes nearly 10,000 deaths in London alone, according to King's College London. You would make all the people who ride instantly healthier because they'd be doing exercise. And you would instantly reduce congestion, meaning travel time would improve for people who needed to be in vehicles. Getting people on bikes really is a silver bullet. It's been said that cycling is the most efficient mode of transport in the known universe, so why not take advantage of it? Part 3. Tour de Force. The answer to Simon's question among many non-cyclists is often twofold. safety and comfort. While perceived safety is largely dependent on government-funded infrastructure and the behaviour of other road users, comfort is something that podiatrists can help with. Bruce Morris is a lecturer in podiatry, teaching undergraduate biomechanics at Edinburgh's Queen Margaret University, and an experienced road and criterium cycle racer. As a podiatrist, I tend to become a point of questioning among my cycling friends, says Bruce. Normally on a training ride, someone will come alongside and say they're having a problem. The types of conditions that I usually see are things around forefoot pathologies. The main ones will be neuralgic symptoms affecting the forefoot area. That will give some symptoms that are more attributable to a plantar digital nerve compression or agitation. Then we'll also see the usual compressive aspects on structures. That would be more the idea of what cyclists call hot foot, prolonged forefoot pressure over a longer period of time. Another thing that we see perhaps more with older riders is issues where they start to lose some of their plantar fatty padding around the forefoot area. That can shift distally towards the digits, or they might just lose that padding generally. Cyclists tend to have lower body fat than other people, so that is something that we will pick up. And the interaction with the cycling shoe, which may be relatively stiff, a lack of space, and the cyclic force applied at the forefoot areas often leads to general forefoot pain. Part 4. Trifecta troubles. The relationship between a cyclist's feet, shoes, and pedals is unusual in sports, with only skiing coming close. Keen cyclists use clipless pedals, which see a cleat bolted to the bottom of their shoe clip into a corresponding pedal clamp to create a fixed connection. A twist of the foot releases the shoe from the clamp. However, there are aspects to this system that can be adjusted, which can improve patient symptoms and comfort on the bike. David Gruhl, sports podiatrist with Complete Physio, worked with some of Australia's top cyclists before moving to the UK. He says that the relationship between foot, shoe and pedal is often at the root of cyclists' foot problems. As podiatrists, we are trained with a unique blend of anatomy, injury management, and biomechanics. This combination of knowledge, specifically around pathology and anatomy, can be an area where bike shops or bike fitters have a blind spot. As such, a podiatrist may be able to offer a greater insight in the treatment of foot complaints on a bike, David says. For example, forefoot discomfort is the most common foot complaint among cyclists, and our experience would suggest that this could be due to peak forefoot loads or compressive forces, or possibly something else. In the shoe insole cleat trifecta, there are many variables that we can manipulate. Shoe fit is concerned with length, width, and depth. If too long, then the cleat position will be too distal. If too narrow or lacking depth, then compression forces are increased. Cleat position can be amended in both rotation, heel in or heel out, but also distal and proximal shift. In the case of forefoot overload, consider shifting cleats as proximal as possible. Moving the cleat towards the midfoot can also help with rear foot conditions, reducing the dorsiflexion and plantar flexion required. However, the cyclist must also take into account that a saddle height and fore-inch aft adjustment may also be needed. Part 5. Holistic approach. Elite cyclists in particular have popularized the idea that finding marginal gains in different areas combine to a significant overall advantage, but a holistic approach to cycling is important at all levels. An appreciation of the relationship between feet and knees, and hips and torso, and everything in between is a key part of treating any cycling issue, and a reason why bike fitting, where a rider's position on a bike is examined and adjusted by experts, is a common choice among keen cyclists. However, Podiatrists working alongside physiotherapy and strength and conditioning colleagues can play a key role in this process too. While foot and ankle injuries often align with deficits in strength and conditioning requirements, orthosis can form one aspect of a larger management plan. David's early career was spent working for cycling orthotic manufacturer Cobra 9, and he continues to offer handmade orthotic solutions to cyclists. Issues such as persistent knee discomfort can be addressed by making the bike fit as well as possible, David says. In reality, the patient probably needs to do some stability rehab work with a physiotherapist or strength coach, but we can possibly use an orthotic as an additional interventional modality. The design of foot orthoses between typical ambulatory devices and cycling should differ significantly, in my opinion. In typical walking gait, there is much greater shape change to the medial longitudinal arch and multiple vectors of force. However, in cycling, we are primarily dealing with downward force with little to no forefoot extension. As such, I would always design cycling orthoses with a more aggressive and longer shell shape. Additionally, as a lot of foot issues are irritated with compression, selecting materials and designing foot orthoses so that they minimize the space they occupy in a cycling shoe will always be superior. Part 6. Recovery Tool. David touched on the different foot and ankle motions apparent in cycling. The fact that the rider's foot is limited in its movement can make cycling an excellent general option post-injury, Bruce says, but only up to a point. Cycling is unique when it comes to ankle mechanics, and it can be helpful for certain things in terms of someone's rehabilitation pathway, Bruce says. The ankle is limited in its effective range of motion when cycling. Dorsal flexion and plantar flexion is never really extended into the extremes of the ranges of motion. That can be helpful for developing cardiovascular benefits and general health without straining the soft tissues in that area. Cycling also offers a marked reduction in force being transferred back through the lower limb joints, which is why it is often incorporated in rehabilitation. However, let's say you are dealing with a runner rather than a cyclist. That limited range of motion and reduction in force throughout the joints will, at some point, cease to be helpful, and you will have to progress them on to actively load them past that point. In terms of the frontal and transverse motions, cyclists are not exposed to as much of that compared to runners, so you would not have a very robust foot and ankle if all you did is cycling as part of your recovery, and you would need to introduce rehabilitation work to challenge the combined motions available at the foot and ankle. Part 7. Multidisciplinary Team. With such a huge range of specialized cycling-specific considerations to take into account, how can podiatrists even begin to treat cyclists effectively? Both Bruce and David agree that having a good initial conversation with the patient to understand their goals is key, as is having access to a wider team of experts or being able to refer on when your knowledge base reaches its limits. You need to gain an understanding of a patient's cycling history, Bruce says. Are they new to cycling? Or is this something that they have always done? Then understand their general athletic background and get a good general medical history. Often there are clues in the athletic history that they are a predisposed athlete to injury. Further to this, what equipment or conditions was the athlete using? And find out if there have been any inciting events, particularly incidents or crashes, that may link into secondary problems that could come up. I always think it's helpful to find out at what stage in that athlete's training journey they are. Are they in a block of high intensity, or are they in a block of endurance training? That might then demonstrate things in a very different way. For instance, you might have a little bit more muscular and tenderness pain in an intensity block, because it's more explosive in nature. In an endurance block, you might find they have some other conditions, such as joint pain, due to being in the saddle a lot longer. Get into the specifics of what kind of cycling they are doing. What kind of footwear are they using? Have they had a proper bike fitting done? And has a specialist looked at their position? Are they aware that you can be too high or low in the saddle, too far forward, too far back? Often you are the first person to raise these questions, but it can lead to the patient needing treatment from a wider team. One final thing to appreciate is the racing cyclist's fabled ability to tolerate pain. Will cyclists live with a little bit of discomfort if it improves their performance? I certainly do, Bruce laughs. For recreational cyclists who aren't in a more fixed position and who sit in a more upright position, I think comfort will be the determining factor for them coming to see a podiatrist. For racing cyclists or elite cyclists, there is always going to be an element of discomfort because they are trying to cheat the wind the whole time. But cyclists, like other athletes, are very in tune with their bodies, and they can distinguish between that normal background level of discomfort and something that is an issue that needs to be addressed. So it is important that patients identify if the issue is something normal for them, or if this is a different kind of discomfort. That's ultimately the determining factor.